Ever get the feeling that we're just starting to understand the full impact of COVID-19?
Oh, absolutely.
It's like we're seeing the aftershocks,
Yeah.
And that's what today's deep dive is all about. We're digging into a research paper you sent over
Okay.
called Vascular Pathogenesis in Acute and Long COVID.
Right.
Catchy, right.
Yeah.
But get this. It's basically saying that damaged blood vessels might be the key to unlocking the mysteries of long COVID.
It really is fascinating, this kind of shift in perspective, because we often we often associate COVID-19 with respiratory issues, right?
Right.
Shortness of breath and all that.
Makes sense.
But this research, it really highlights the impact on the vascular system, the blood vessels.
It's like it goes deeper than we thought.
Deeper, yeah, both in the acute phase when you're initially infected, and then in the long term as well.
So long COVID, or for those who haven't encountered it personally, it goes by the very scientific name of PACE, which stands for post-acute sequelae of COVID-19.
Catchy.
But basically, we're talking about symptoms that linger for months or even years.
Yeah, the long haul, as they call it.
Exactly. And this research suggests that damage to our blood vessels could be a major player in those symptoms that just won't quit.
It's a big piece of the puzzle, it seems.
This is where things get really interesting for me.
Okay.
The paper spends a lot of time on these tiny little cells called endothelial cells that line our blood vessels.
Right.
What's the deal with these cells and why are they so important in all of this?
So think of it this way, okay?
Okay.
Your blood vessels, they're like a complex highway system.
Okay, I like that.
And these endothelial cells, they're like the unsung heroes, the traffic controllers.
Keeping everything flowing.
Exactly. They regulate blood flow. They make sure oxygen and nutrients reach your organs.
Like the delivery system.
Yes. And they even play a crucial role in preventing clotting and managing inflammation. So they wear many hats.
So if these cells are damaged, it's like throwing the whole traffic system into disarray.
Precisely.
Yeah.
The research paper, they call it endothelial dysfunction, and they actually describe two main types.
Two types, okay.
Yeah, so type I, that's like a rapid response to injury or infection, right? Think of it like a sudden lane closure on the highway.
Okay.
It's usually temporary, resolves pretty quickly.
Okay.
But then you have type 2, this is where it gets a little trickier. It's a slower, more sustained response, more like long-term road closures and detours. Disrupts the flow for much longer.
And that's what we're seeing with long COVID, this type 2 dysfunction sticking around.
That's what the research suggests, yes, unfortunately.
So even a mild case of COVID can kind of set the stage for this long-term damage.
That's the thing. Even mild cases can trigger this widespread endothelial dysfunction.
Wow. And what is it exactly that's causing this dysfunction? Is it the virus itself or?
Well, it seems one of the main culprits is the infamous spike protein.
The spike protein always causing trouble.
Always up to no good. It seems that the spike protein, especially the S1 subunit, it can directly interact with these ACE2 receptors on the surface of those endothelial cells.
Now remind me what those ACE2 receptors do again.
Right, so those ACE2 receptors, they're key for regulating blood pressure and inflammation. They're like the communication hubs for those traffic controllers, making sure everything is balanced.
Okay, got it.
But when the spike protein latches onto them, it disrupts those communication lines, throws everything out of whack.
So it's like the spike protein is jamming the signals.
Exactly. And to make matters worse, this disruption can trigger a cascade of inflammatory responses that further damage those delicate endothelial cells.
So we've got damaged traffic controllers, inflamed highways. This is not looking good.
Not a pretty picture.
The paper also mentioned something called microclots. How do those fit into this whole vascular chaos?
Right, so remember how I said those endothelial cells help prevent clotting? Well, when they're damaged, things can get sticky, literally. Microclots. They're tiny, incredibly stubborn clots that can form because of the inflammation and the damage caused by, you guessed it, COVID-19.
They're like tiny little roadblocks.
Yes, like tiny fender benders, clogging up the flow of traffic in your blood vessels.
And these microclots are a big deal in long COVID.
They are. You see, these microclots can lodge in the tiniest of blood vessels, hindering oxygen delivery to your tissues and organs.
Oh, wow.
And because they're blocking that flow, you start to see all sorts of symptoms. Brain fog, fatigue, muscle aches, shortness of breath, you name it.
So if someone's dealing with long COVID, it's not just in their head.
No.
There could be actual physical blockages in their system causing these debilitating symptoms. That's kind of groundbreaking stuff.
It is. It really changes how we think about the long-term effects.
So how do you even know if these microclots are the culprit? They sound almost impossible to detect.
You're right, they don't show up on standard blood tests. Researchers had to get creative to identify these microscopic
Like
troublemakers.
microscopic detectives.
Exactly. They use a special stain that binds to a particular type of fibrin found in these microclots, makes them visible under a microscope.
So they can literally see these tiny clots.
Precisely.
Wow. And are they finding them in long COVID patients?
They are. And what's really striking is that they're finding them months after the initial infection, which suggests these persistent clots could be a driving force behind those long-lasting symptoms.
Well, this is heavy stuff. We're talking about a whole new understanding of how viruses can impact our bodies long after the initial infection.
It is. It's like a domino effect with those damaged blood vessels leading to a cascade of problems.
Okay, but before we get too bogged down on the doom and gloom,
Right.
let's shift gears a bit and talk about how we can actually detect this endothelial dysfunction early on.
Okay. Yeah.
The paper did mention some promising diagnostic tools.
It did. And that's where things start to get hopeful.
So are we talking early detection with these tools? Like,
Yeah.
can we see this damage before people even feel bad?
That's the hope, right? Catch it before those symptoms take hold.
Exactly.
One method that's looking really promising is something called flow-mediated dilation, FMD for short.
FMD.
It's a type of ultrasound, so totally non-invasive,
Good to know.
and it measures how well your blood vessels dilate in response to increased blood flow.
So if I'm understanding this right, it's like we're seeing how flexible those blood vessels are.
Basically, yeah, it's like a stress test for your arteries and veins.
Clever.
And it gives us a glimpse into how well those endothelial cells, those traffic controllers, are doing their job.
So if your blood vessels aren't dilating properly, that's a red flag.
Could be an early warning sign of endothelial dysfunction, even before any symptoms show up.
Okay, that's huge, though, because if you know there's a problem,
You can start addressing it, exactly.
the paper mentioned other techniques, too, like
Oh, yeah, there's a bunch of research going on in this area.
looking at the tiny blood vessels in your fingernails, for example.
Right, nail fold video capillaroscopy.
Say that 5 times fast.
No, it's a mouthful, isn't it? But fascinating stuff.
It is. It really is.
Yeah.
It's like our bodies have all these hidden clues.
They do, and the more we can decipher those clues,
Yeah.
the better equipped we'll be to tackle this.
Makes sense. Okay, so we've talked about detection, but what about treatment? What can actually be done to repair this vascular damage and deal with these microclots? Is there anything?
That's the million-dollar question, right?
Yeah.
Unfortunately, there's no magic bullet yet, but the research is definitely pointing to some promising avenues.
Okay, well, that's something.
One approach is actually using existing medications, anticoagulants, and antiplatelet agents.
Yeah.
You know, the ones typically used to prevent blood clots.
So using them kind of off-label for this specific type of clotting.
Exactly. Because they work in slightly different ways, researchers are trying to figure out if they can dissolve existing microclots or even prevent new ones from forming in long COVID patients. It's still early, but some studies are showing positive results.
Fingers crossed, because that could be a game changer for some people.
Absolutely. And then there are more experimental therapies being explored, like drugs that specifically target the abnormal fibrin found in these microclots.
So going after those stubborn clots with, like, pinpoint accuracy.
You got it. It's all about finding the most effective and safest ways to address this.
Okay, that's promising.
It is, but in the meantime, there are things people can do on their own to support their vascular health, especially if they're dealing with long COVID.
Okay, so what can people do? Give us the rundown. What helps?
A lot of it comes down to managing traditional cardiovascular risk factors. So, maintaining a healthy weight,
Okay.
making a balanced diet, regular exercise.
The usual suspects, right?
Pretty much, yeah. But it makes a difference. These things can improve endothelial function and reduce inflammation, which is key.
It's giving your body the best possible chance to heal.
Exactly. Oh, and there's actually some interesting research emerging about a potential link between gum disease and long COVID.
Wait, really? Oral health?
Yeah, it seems that inflammation from gum disease could actually exacerbate endothelial dysfunction.
Wow, that really highlights how interconnected everything is in the body.
It does. You wouldn't necessarily think about oral health being related to long COVID.
Not at all.
But when you consider that inflammation is a common thread and that it affects the vascular system.
Right, it starts to make more sense.
Exactly. It all comes back to those blood vessels and those endothelial cells.
Okay, so we've covered a lot of ground here. The impact of COVID on our blood vessels, those tiny but mighty endothelial cells, microclots, treatment approaches. It's a lot.
It's a lot to take in, for sure.
So what are some of the key things you hope listeners will walk away from this conversation with? What's the big picture here?
I think The biggest takeaway is that even though long COVID is complex, even frustrating at times, we're making progress in understanding it. The discovery of these microclots and really understanding the role of endothelial dysfunction.
It's changed the game, hasn't it?
Hugely. It's opened up new avenues for research and hopefully more effective treatments down the line.
It's like we zoomed in on this one tiny thing.
Right.
And suddenly we're seeing all these connections.
It's all connected. This research isn't just about long COVID either. It's changing how we approach other conditions involving inflammation and vascular health in general.
So this deep dive into long COVID might actually hold the key to breakthroughs in other areas of medicine.
It's definitely possible, and that's what makes this kind of research so exciting. You never know where it might lead. We often start with one question and end up uncovering a whole new world of knowledge and possibilities.
It's true. You never know what you're going to find.
Exactly.
This deep dive has definitely had its aha moments for me, that's for sure.
Glad to hear it.
But before we wrap things up, is there one final thought-provoking question you'd want to leave our listeners with? Something for them to ponder as they continue their own deep dives into this topic.
How about this? If damage to those tiny blood vessels is playing such a significant role in long COVID, what other health conditions might be linked to this kind of vascular damage that we haven't fully recognized yet?
Like we're just scratching the surface of what we don't know.
It's a real possibility.
Wow, that is something to think about.
Yeah.
It really makes you wonder, are we missing something with other conditions?
It's possible, and that's what's so exciting about science, always more to uncover.
Exactly. This research could have implications far beyond long COVID, right?
Absolutely. It's like a ripple effect.
So to our listener who sent this research in, thank you. And if you're struggling with long COVID, maybe this sheds some light on things for you.
It's always good to have more information.
Definitely. Talk to your doctor about these findings. See if any of those diagnostic tools or potential treatments could help in your case.
It's about advocating for your own health, being informed.
Couldn't agree more. Well, on that note, we'll wrap up this deep dive with a final thought, something for everyone to ponder. If damage to those tiny blood vessels is so central to long COVID, what other health issues might be linked to this that we haven't fully explored yet?
There's a whole universe of possibilities out there.
It's a bit of a mind bender, right? But that's what we love about these deep dives. Always something new to learn. A huge thank you to our expert for guiding us through this.
My pleasure. Always happy to be here.
And to our listeners, as always, keep those curious minds engaged and those questions coming. Until next time, happy exploring.